I'm Carly and I'm one of the CP Achieve postdoctoral research fellows. The CP Achieve is undertaking a series of surveys on the health, well-being and participation of young people with cerebral palsy aged 10 to 30 years. There are 3 different surveys. The knowledge gained from the surveys will help the team at CP Achieve create resources for young people with CP and their treating health professionals. It will help improve knowledge and healthcare and to determine where more research needs to be done. But to gain a really good understanding of these issues, we need more participants. We've had many people begin the surveys, but not everyone has completed them. The understanding survey is the first one, and it gathers basic information about respondents such as age, gender, and type of CP. The understanding survey also links to the next 2 surveys, so this information does not have to be repeated. 182 understanding surveys have been completed to date with a lot of interesting and important information collected. The majority of respondents so far are Victorian. We need a bit more of that interstate rivalry that occurs with the football to bring up the numbers from other states and territories up to what we've got in Victoria now, or even beyond. It would be great to see more people from other states and territories join up so we can gain a more complete picture of CP in Australia. Apart from where people live, we've had a good range of responses in all other areas, with surveys being completed by self-report, assisted report and proxy report, and across all the functional levels of cerebral palsy. Now we move on to the second survey. This is the participation survey, and it asks about participation in 4 key life areas. These are home life and relationships, education and work, leisure and community, and healthcare. 75 people have completed this survey so far, providing a significant amount of information on participation, but more would help to complete the picture of participation trends of young people with cerebral palsy in Australia. Although we have a bit of a bias towards Victoria currently. Come on, the other states and territories. We'd love more information from other states and territories. I'm now going to focus on the third survey, which is the physical and mental health survey, which has 3 sections. So far, we've had 53 people complete the physical health section. This slide depicts what our survey respondents' current health concerns are. The bigger the word, the more people gave this response, showing that the most common concern is mobility, encompassing walking, balance, and moving and strength. Spasticity and muscle stiffness were the next most commonly reported concerns, followed by general health, pain, and sleep. When asked about future health concerns, mobility was again the most frequent concern. The striking difference between current and future health concerns is the different responses or new concerns for the future. These concerns are about uncertainty of the future, continuity of care, attending adult hospitals, aging in general, and not knowing what to expect or who is going to support them through this process. As this was a brief and early analysis of results to date, I cannot tell you yet if those expressing concerns about the future are still in paediatric care or if they've actually transitioned to adult health care. We will know this when the full analysis is complete, and it may help us in knowing where and when to address these concerns. This is just a snapshot or a taster of what we have, and if you'd like your opinion counted in our results, it's not too late to do the surveys. We'd love to hear from more people with CP or their family members. Pain, fatigue, and sleep issues are commonly reported in the international literature as being problematic in people with cerebral palsy, And so we wanted to know if this was also a problem and affected Australians with cerebral palsy. This graph shows that the results for pain on the left, fatigue in the middle, and sleep on the right, with the blue bar representing the percentage of people saying, yes, they do have this issue, the orange bar representing, no, I don't have this issue, and grey is for some people who are unsure. Our survey data on pain is similar to that reported in international studies where up to 87% of people with CP report pain. Our results are twice as high for fatigue than that reported in the international literature. And we know also that relationships exist between pain, fatigue, sleep disturbances, and signs of depression in adults with cerebral palsy, indicating that they are complex and often interrelated concerns. And we can see from our respondents that they are common concerns for people with CP in Australia too. The second section in this survey is on mental health and wellbeing. We've had 52 people complete this section so far. This graph shows the mental health status of survey respondents by self-report in blue or as reported by a family member in orange. The middle bar relates to coping, and unfortunately there is a large percentage of young people with CP reporting to be just coping. Although less, too many people report to be struggling, and only between 30 to 40% of people report to be thriving. Of the 59 respondents, 19 or 37% had seen a mental health professional in the last year, while 30 or close to 60% had not had support from a professional. The most frequently seen health professionals for mental health concerns were GPs, psychologists, and psychiatrists. But it can be seen that advice is sought from a wide range of professionals. The types of mental health supports received also varied, and although medicines were the most frequently accessed, a variety of modalities was received from the provision of information, cognitive behavioural therapy, counselling, and help to meet other people in the same situation for support or company. Respondents used various self-management strategies, and as a physiotherapist, I was pleased to see people participating in physical activity to improve their mental health. Physical activity and mental health have positive associations due to the release of endorphins or happy hormones, as well as other benefits such as being social, sometimes outdoor, or even just changing the focus of thought. We all know how it can be challenging to implement self-management strategies, and even more so with the barriers faced by people living with CP to overcome, such as access and attitudes, to name a few. Spending time doing enjoyable activities was high on the list alongside meditation, mindfulness, yoga, and positivity. It was good to see there was not a large reliance on alcohol or drugs, with this method employed by only one survey respondent. The third and final section is about sexual health, and this has been completed by 49 people so far. This section of the survey was only open to those aged 14 years and above to coincide with sex education in the school system. That sexual health may not be discussed or monitored in young adults with cerebral palsy. When asked if they'd had these conversations about important issues, we can see that well less than half of the respondents are having important conversations with their healthcare professionals. So that makes you wonder, where else are they getting information from, if indeed they are? Surprise, surprise, the internet was the most widely accessed source of information, followed closely by mothers or female guardians and school programs. When asked about their understanding of various sexual health topics, about 60 to 70% of respondents felt they had a good understanding of most topics. Less people had a good understanding of the genetic risk of having cerebral palsy and of CP-specific sexual and reproductive health. Again, this is just a small snippet of our results. There is much more to analyse and share. So already we're gaining an understanding of people's concerns and where resources may be best focused. As we analyse the data more thoroughly, when the surveys close, a greater understanding of the health, wellbeing and participation of Australians with cerebral palsy will be gained. Speaking of closures, the surveys are still open, so if you have not enrolled, please do. As I mentioned earlier on, we've also had a large number of people begin the surveys but not complete them. If you require any assistance to complete the surveys, any of the CP Achieve team can be contacted to help if need be. We'd also love you to share the surveys with your networks. Thanks so much for listening in tonight, and stay tuned to what we find out from the surveys.